Did you know that over 2.2 billion people around the world have some kind of vision problem? Imagine waking up and realizing your sight isn't as clear as it used to be. For many, this happens as they get older. Eye problems like cataracts, glaucoma, and age-related macular degeneration often cause vision loss, sometimes without warning signs. That's why preventing these issues early is important. In this video, we'll talk about the best vitamins to help protect your eyes, lower the risk of eye problems, and keep your eyes healthy long-term. Whether you're worried about aging, have a family history of eye issues, or just want to keep your vision clear, these vitamins can really help. Stay tuned to the end for some helpful tips, and don't forget to like and subscribe for more health tips. As we age, our eyes can face many issues, so it's important to know about common eye diseases. Some of the most common are macular degeneration, which affects central vision, cataracts, which cloud the lens, and glaucoma, which damages the optic nerve. Age, family history, smoking, and a poor diet can increase the chances of these problems. Early prevention and quick action can make a big difference, so it's important to understand these risks to protect your eyes. Your eyes, like the rest of your body, need proper nutrition to work well. Bad nutrition and stress on the body can lead to vision problems, and not getting enough important vitamins can raise the risk of eye diseases. Adding key vitamins to your diet can help protect your eyes, improve your vision, and reduce inflammation. Let's take a closer look at the most important vitamins for eye health. Vitamin A, the vision booster. Vitamin A is one of the best vitamins for eye health, helping to keep your vision clear, especially in low light. It helps create rhodopsin, a pigment in the retina that lets us see in the dark. If you don't get enough vitamin A, it can cause night blindness, making it hard to see in dim light and increasing the risk of accidents. This vitamin also helps prevent eye problems and keeps the cornea, the outer layer of the eye, healthy and moist. A healthy cornea helps prevent dryness, irritation, and infections, and it protects against age-related eye issues like cataracts. Vitamin A also fights oxidative stress, reducing damage from free radicals that can harm your eye cells and lead to disease. By getting enough vitamin A, you can improve your eyesight and protect your eyes in the long run. Best sources of vitamin A: carrots, sweet potatoes, pumpkins, mangoes, leafy greens, spinach, kale, liver. How to maximize absorption. Since vitamin A is fat-soluble, pairing it with healthy fats like avocado, olive oil, or nuts can help your body absorb it better, allowing you to get the most out of it for your eye health. Vitamin C, the antioxidant shield. Why it's essential. Vitamin C is a strong antioxidant that helps protect your eyes from oxidative stress, which can cause eye problems like cataracts and glaucoma. The lens of the eye naturally contains a lot of vitamin C, helping it stay clear. As we get older, our vitamin C levels in the eyes drop, so it's important to get enough of this vitamin to support your vision. Taking in enough vitamin C can help slow this natural decline. Besides protecting against damage, vitamin C is important for producing collagen, a protein that keeps the cornea and sclera, the white part of the eye, strong and healthy. Collagen is crucial for the flexibility and strength of these eye tissues, ensuring they work properly. Vitamin C also helps with blood flow to the optic nerve, which can lower the risk of glaucoma. By adding more vitamin C to your diet, you can strengthen your eye health and protect your vision. Best sources of vitamin C: oranges, grapefruits, bell peppers, strawberries, broccoli, kiwi. How to maximize absorption. Since vitamin C is water-soluble and loses nutrients with heat, eating raw fruits and vegetables is the best way to get the most out of it. Pairing vitamin C with vitamin E can also boost its protective effects, giving your eyes extra defense. Together, these vitamins work to protect your vision. Vitamin E, the cell protector. Vitamin E is a potent and essential antioxidant that plays a crucial role in safeguarding the health of your eyes. As a powerful antioxidant, it helps protect the delicate cells in your eyes from the damaging effects of free radicals, which are unstable molecules that can cause oxidative stress and cellular damage. Free radicals are a byproduct of normal metabolic processes, but can also be generated by external factors such as UV radiation, pollution, and smoking. When free radicals accumulate in the body, they can harm the cells and tissues in the eyes, leading to potential long-term damage. One of the primary functions of vitamin E in eye health is its ability to prevent age-related eye conditions, including cataracts and macular degeneration. These conditions are often linked to oxidative stress, where free radicals damage the proteins and tissues in the eye's lens and retina. Cataracts, for instance, are caused by the clouding of the eye's lens, which impairs vision, while macular degeneration affects the retina, leading to vision loss in the central field of sight. By neutralizing these harmful free radicals, vitamin E can significantly reduce the risk of developing these debilitating eye conditions. This makes it an important part of an eye care routine, especially as we age. Free radicals can damage not only the eye's lens but also the sensitive retina, which is responsible for transmitting visual information to the brain. Over time, this can result in deteriorating vision and even permanent vision loss. By incorporating vitamin E into your daily routine, you can help mitigate these risks, slow down the aging process of your eyes, and maintain optimal vision for a longer period. In addition to its protective role against oxidative damage, vitamin E is vital for supporting the immune system. A strong immune system is essential for keeping your eyes free from infections and inflammation, which can lead to discomfort and vision problems. For individuals with conditions like dry eye syndrome, vitamin E offers added benefits by improving tear production and tear quality, thereby alleviating the discomfort associated with dry, irritated eyes. The enhancement of tear quality can make a significant difference in relieving eye irritation, itching, and the burning sensation often experienced with dry eyes. Vitamin E's ability to support both eye health and overall comfort makes it a key nutrient in maintaining long-term eye function. Whether you're trying to prevent age-related vision loss or seeking relief from dry eye symptoms, vitamin E is an essential part of eye care. Including it in your diet can provide both preventive and therapeutic benefits, helping you enjoy clear, comfortable vision for years to come. Best sources of vitamin E. To ensure you're getting enough vitamin E for optimal eye health, consider incorporating these foods into your diet. Almonds, sunflower seeds, hazelnuts, spinach, avocados. How to maximize absorption. Vitamin E is a fat-soluble vitamin, which means it is best absorbed by the body when consumed with healthy fats. To ensure that you are maximizing the benefits of vitamin E, it is important to pair it with foods rich in healthy fats. For example, consuming vitamin E-rich foods like spinach, almonds, or avocado with a drizzle of olive oil, or alongside fatty fish such as salmon, can enhance the absorption of this vital nutrient. This will ensure that vitamin E is fully utilized by your body to protect and maintain the health of your eyes. Quick reminder, if you're finding this helpful, don't forget to subscribe for more tips on improving your vision. Vitamin D, often referred to as the sunshine vitamin, is essential for maintaining optimal eye health. This vital nutrient plays a significant role in reducing eye inflammation, a common cause of various eye disorders. Chronic inflammation is linked to several eye conditions that can severely impact vision, including age-related macular degeneration, AMD, dry eye syndrome, and diabetic retinopathy. By helping to regulate and reduce inflammation in the eyes, vitamin D can lower the risk of these conditions and support long-term eye health. One of the key benefits of vitamin D is its ability to control intraocular pressure, IOP, which is the fluid pressure inside the eye. Elevated IOP is a significant risk factor for glaucoma, a group of eye diseases that can lead to irreversible vision loss. By helping to maintain healthy intraocular pressure, vitamin D can reduce the risk of glaucoma and protect the optic nerve from damage. This makes vitamin D an important nutrient for people at risk of or already dealing with glaucoma. Additionally, vitamin D supports the health of the retina, the thin layer of tissue at the back of the eye that plays a crucial role in vision. It helps improve blood circulation to the retina and strengthens the blood vessels within the eye. This is particularly beneficial for individuals with diabetes, as they are at a higher risk of diabetic retinopathy, a condition that can damage the blood vessels in the retina and impair vision. Vitamin D helps prevent damage to these blood vessels, potentially reducing the risk of diabetic retinopathy and other retinal conditions. Best sources of vitamin D. To ensure you're getting enough vitamin D for eye health, here are some of the best sources. Vitamin D is naturally produced by the body when the skin is exposed to sunlight. Just 15 to 30 minutes of sun exposure daily can provide adequate levels of vitamin D, although this can vary based on skin tone, geographic location, and time of year. Fish such as salmon, tuna, and sardines are rich in vitamin D. These foods not only provide vitamin D but also contain omega-3 fatty acids, which are beneficial for overall eye health and reducing inflammation. Eggs, particularly the yolks, are another good source of vitamin D. Incorporating eggs into your diet can help ensure that you're getting a sufficient amount of this important nutrient. Fortified milk and orange juice. Many dairy products and some fruit juices are fortified with vitamin D, making it easier to meet your daily requirements. Look for products labeled as fortified with vitamin D for an extra boost. UV-exposed mushrooms. Some mushrooms that have been exposed to ultraviolet UV light are a plant-based source of vitamin D. These can be a great option for vegetarians or those looking to diversify their vitamin D sources. Supplementation tip: while sunlight is the best natural source of vitamin D, many people struggle to get enough, especially during the winter months when sunlight exposure is limited. If you live in a region with long winters, or if you have limited sun exposure due to your lifestyle or work schedule, supplementation might be necessary. Before starting a vitamin D supplement, it's important to consult with your healthcare provider to determine the appropriate dosage for your individual needs. They can help you choose a supplement and ensure you're getting the right amount without exceeding safe levels. The importance of vitamin D for eye health, in addition to its role in reducing inflammation and preventing conditions like AMD and glaucoma. Vitamin D is involved in several other bodily processes that can indirectly impact eye health. For instance, vitamin D supports immune system function, which can help protect the eyes from infections and other diseases. Furthermore, research has shown that vitamin D may have neuroprotective effects which can support the health of the optic nerve and help prevent conditions like optic neuropathy. By maintaining adequate levels of vitamin D through sunlight, diet, or supplementation, you can support not only the health of your eyes, but also your overall well-being. A balanced intake of this essential vitamin helps reduce inflammation, supports proper intraocular pressure, and promotes healthy blood flow to the retina, making it a critical component of a comprehensive approach to eye health. B vitamins, especially B6, B9, folate, and B12, are important for protecting the optic nerve and overall eye health. These vitamins help lower homocysteine levels, an amino acid linked to a higher risk of age-related macular degeneration, AMD, and glaucoma. Keeping homocysteine levels in check is crucial for eye health because high levels can harm the eyes. Vitamin B12 is key for maintaining the myelin sheath, a protective layer around the optic nerve, which helps signals move between the eyes and the brain. Without enough B12, the optic nerve can get damaged, causing issues like blurry vision, color distortion, and even optic neuropathy. Getting enough B vitamins is essential for improving vision and preventing eye diseases. Incorporating B vitamins into your diet can help maintain sharp vision and prevent age-related eyesight issues. These vitamins are some of the top choices for protecting the nerves that help us see. Best sources of B vitamins: leafy greens, fortified cereals, eggs, dairy products, poultry, seafood. Special note for vegans: since vitamin B12 mainly comes from animal products, vegans may need a supplement to avoid deficiencies that can lead to eye problems. Omega-3 fatty acids, especially DHA, docosahexaenoic acid, and EPA, eicosapentaenoic acid, are essential for overall eye health. DHA is an important part of the retina, supporting its structure and function, which helps keep your vision clear. Getting enough omega-3s is linked to a lower risk of age-related eye damage and helps protect against eye conditions that get worse over time. Omega-3s also have strong anti-inflammatory effects, reducing inflammation in the tear glands, which improves tear production and relieves dry eye syndrome. They also help fight oxidative stress, which can damage retinal cells and lead to conditions like macular degeneration and diabetic retinopathy. By eating omega-3 rich foods regularly, you can support healthy eyes and reduce the risk of serious eye diseases. Best sources of omega-3 fatty acids include fatty fish like salmon, mackerel, sardines, and tuna. For plant-based options, chia seeds, flax seeds, walnuts, and algae oil are excellent choices. If you don't get enough omega-3s in your diet, fish oil or algae-based supplements are a good option to help ensure you're getting the fatty acids your eyes need. These supplements can support retinal health, even if your diet lacks omega-3 rich foods. Your eyes are your windows to the world, so protecting them is very important. By adding these essential vitamins to your daily diet, you can protect your vision from age-related issues like cataracts, glaucoma, and macular degeneration. Eating a nutrient-rich diet and getting regular eye exams can make a big difference in keeping your vision healthy. Whether through whole foods, fortified options, or quality supplements, focusing on eye-friendly nutrients is a great way to support lifelong eye health. Will you be adding any of these vitamins to your routine starting today? Drop a comment and let us know. We'd love to hear from you. If you found this video helpful, don't forget to like and subscribe for more tips on maintaining your health and wellness. Hit the bell icon so you never miss an update. And if you want to learn about more natural remedies for health, watch this next video.